We're going to study the muscles and vessels that are associated with the shoulder region. And what we're looking at here is a posterior view of the two shoulders. This is the dissection as we left it when we did the laminectomies. We're going to be looking at first the muscles on the posterior side, and then we'll be looking at the muscles on the anterior side. There really are only two incisions or cuts that you have to make for this dissection, and these are to cut the muscles which are attached to the scapular spine. So as you can see here, we have the deltoid muscle, and of course it's going to be attached to the clavicle, to the acromion, and to the scapular spine, so that you want to make an incision that comes around the top of that muscle so that we can reflect it from its bony attachments here. And the second muscle which has to be cut is the trapezius, which you can see right here. That portion of it which is inserting on the scapular spine from above also has to be cut, and we've already done this. And I'm going to reflect the trapezius muscle so that we can look at some of the muscles which lie beneath. Now, of course, the trapezius muscle is a mover of the shoulder girdle, meaning that it attaches to the scapula and does not attach to the humerus. So this is one of the muscles which move the shoulder girdle, the trapezius. And when we reflect the trapezius, there are going to be two other muscles that we can see which are extending over to the cut spinous processes, and these are going to be the rhomboids. There's a rhomboid minor and a rhomboid major. It really looks like one continuous muscle, and in some cases you actually can't see the distinction between the two. Nevertheless, both of the portions of the rhomboid have the same function. So we have the rhomboid muscle here, which is going to be deep to the trapezius. It's going to be inserting along the vertebral border of the scapula. And just proximal to the rhomboid muscle is the levator scapulae. It also is coming from cervical vertebra, and it's coming down to attach to this angle of the scapula up here. So it moves only the shoulder girdle. Now, in order to see some of the muscles which are deep to the deltoid, we want to reflect it after having cut it from its proximal attachments. And we're looking at this from the posterior aspect. And as I bring it forward, one of the things that you're going to be looking at is a portion of the triceps muscle here. This is the teres minor here, and coming out just underneath the teres minor muscle is going to be the innervation and nerve supply of the deltoid. And of course you saw these in a previous dissection as the posterior humeral circumflex and the axillary nerve, so that they are winding around the humerus to enter the body of the deltoid at this point. So just note that you can actually cut them away after you've made that notation. After you've moved the deltoid forward, this allows you to look at some of the muscles which are attached to the scapula, that is arising from the scapula, and moving over to the humerus, which is right here. So the head of the humerus is right here beneath the acromion, which is right there. Now there are two muscles which are located just inferior to the spine of the scapula, and this meaty area in here is all the infraspinatus. Now there's usually a small line of fat which runs along here, and you will look for that because that will allow you to separate the really small teres minor from the infraspinatus, which is right here. So in doing that, that's about all that you can do to separate these two muscles. Both of them are coming over here to insert on the head of the humerus. And then just inferior to the teres minor is going to be the larger and bulkier teres major, which would be right here. And once again, there will be some loose connective tissue to allow you to separate the minor from the major. And finally, a muscle that we saw previously in our dissection and we cut away from its attachment to the midline, this would be the latissimus dorsi, which is just inferior to the teres major. Now the last thing that the reflection of the deltoid allows you to do is to look at the triceps muscle in some detail. The triceps, of course, has 3 heads, and you can separate 2 of the heads by finding this cleft between the more tendinous portion of the lateral head of the triceps from the long head of the triceps, which is right here. The medial head is a little more difficult to find, and we have to look down in the cleft between these 2 heads, the long and the lateral head, and we're looking down now onto the humerus, and I think you can hear me tapping right against the humerus, and this muscle that you can see right here against the humerus is the medial head of the triceps. And running right along the medial head of the triceps, I can pull up the radial nerve, which is wrapping around the midshaft of the humerus. So we've seen 2 nerves which have been wrapping around the humerus at this point. The radial nerve wraps around the midshaft of the humerus, and then proximally, just beneath the head of the humerus, we have the axillary nerve. And finally, we'll be looking at the other constituents of what is called the rotator cuff when we turn the specimen over and look at it from the anterior side. But the sits muscles, S-I-T-S, that's a eponym which refers to the supraspinatus, infraspinatus, teres minor, and the subscapularis. And we can see we have the supraspinatus here coming to insert onto the head of the humerus. Here is the infraspinatus, the S and the I. Here is the teres minor. These are all components of what is called the rotator cuff because they're all rotators of the humerus, and they're all going to be inserting near the head of the humerus on the greater tubercle. We've turned it over. We're looking at the right shoulder from the anterior side. The deltoid is right here. The cephalic vein came up and ran between the margin of the deltoid and the pectoralis major, which I'm holding in my hand. We haven't cut off the anterior portion of the deltoid, although you should. Now, the pectoralis major, a muscle which moves the glenohumeral joint because it attaches to the humerus, is shown right here. You can separate it from the deltoid so that you can move it out of the way, and we can look at some of the deeper structures. So I'm going to do that now. Just reflect it forward. It'll have some pectoral nerves attached to it, which I am going to cut so that we can pull it forward out of the way entirely. And beneath it is a muscle which is coming off of the anterior anterior thorax from the ribs, which of course have been removed, and it extends proximally to insert into the coracoid process right here of the scapula. Since it does not attach to the humerus, it is a mover of the shoulder girdle, not a mover of the glenohumeral joint.